with this week's topic of sexual development, today I'm going to discuss a study and take you through a study that discusses sexual development in male patients with epilepsy. To begin, epilepsy is a disorder that manifests itself through unprovoked seizures. These seizures are a result of incorrect electrical excitivity in neurons. Currently, 65 million individuals in the world suffer from epilepsy. 3 million of these individuals are in the US. Things that cause epilepsy, a lot of which is unknown, could be due to genetics, infections, different types of lesions due to trauma, in older age stroke, structural and chemical changes, and a third of patients with autism also suffer from epilepsy. Currently, 7 out of 10 patients are completely controlled through the use of anti-epileptic drugs. Although these drugs are preventative, so they cannot allow you to be better after you already have a seizure, they prevent seizures from occurring in the first place. There are 26 different types of anti-epileptic drugs. These drugs help to reduce the excessive excitability of neurons and their activity in the brain. Currently, it is known that these seizures cause disturbances in the hypothalamic regulatory axis that has prominent impacts on your endocrine system. So, as we have learned through last week, the hypothalamus is heavily responsible in regulating the hormones that proliferate throughout the rest of your body, and it has downstream effects. So, the hypothalamus is responsible for releasing gonadotropin-releasing hormone, which acts in the pituitary, acts on gonadotropic hormones such as FSH and LH, which in turn end up causing the release of testosterone. And this is only one of the many HPA axes. So you can imagine what can happen if this axis is in some way disturbed on a variety of hormones. This study is going to look specifically at sex steroid hormones. The first is testosterone, which is a substrate for DHT and estrogen, and which has a large impact on the differentiation and development of the male urogenital system, including the Wolfram ducts. Estrogen also is very important in testicular function and in the creation of sperm. As you can see from this graph, normal sexual development has a large range, and there's no one right way to sexually develop, although there is a standard. So first you'd see the growth of the scrotum and testes in a male, followed by that a change in voice, the lengthening of the penis, growth of pubic hair, which is referred to as pubarchy, growth spurt and the growth peak, followed by changes in body shape and the growth of various facial and pubic hair. So in the study that I'm going to look at, it will look at factors in physical and hormonal profiles, both in male patients with epilepsy who are treated with these anti-epileptic drugs. So their hypothesis was that patients who experience epilepsy would have a delayed sexual development in comparison to age-matched controls because of this disruption in the hypothalamic system. Wow, that's not supposed to. 130 patients were looked at in the study who were all on anti-epileptic drugs. They were from the ages of 8 to 18 with a median age of 14, so all individuals who would be experiencing or who had already experienced puberty. They were grouped into 3 separate groups. One was from the age of 8 to 14, the other from 14 to 16, and the last individuals who were older than 16. All these groups had age-matched controls of patients who do not suffer from epilepsy. The measurements that were taken were the classic height, weight, and BMI. In addition, testicular volume, penile length, and pubarchy were measured. Pubarchy, as I mentioned before, was the manifestation of pubic hair. Additionally, hormones and blood samples were measured. Testosterone and free testosterone, additionally estradiol, luteinizing hormone, follicle-stimulating hormone, and prolactin. So, what did they find? First and foremost, they found that patients who were of the oldest group C, above 16, were significantly shorter than their age-matched controls. Next, when they looked at the actual sexual development of these patients, they found a statistical significant difference in all 3 age groups. This included testicular volume and penile length. As you can see, in all 3 age groups, penile length and testicular volume is lower in the patients with epilepsy than their age-matched controls. When we look at the hormonal analysis, we can see that there's an increase in total testosterone in individuals with epilepsy. This may seem as a shock since they're trying to prove whether or not sexual development is being impeded in these patients. However, this is a result from the drugs that they are taking. What is more significant in the study is not the total amount of testosterone that is present, but in fact, the free testosterone that is present. Free testosterone is the testosterone that is not binded to any other chemicals in your body. And this is testosterone that the rest of your body can utilize for functions such as sexual development, the production of sperm, or producing muscles. So this is what is really important, the fact that patients who have epilepsy and who are using anti-epileptic drugs have a decrease in the free testosterone in comparison to the age-matched controls. Additionally, there was an increase in estradiol in the patients who had epilepsy and who were treated with anti-epileptic drugs. Scientists presume that this is a result of the drugs that they were on as well. Lastly, there are low T over LH levels. This is, although it's lower, what it actually represents is the fact that LH levels are higher because of the decimal relationship here. If LH levels are higher, as you remember from the hypothalamic axis, that means that testosterone levels are higher, as was indicated by the study. But again, what was important was that free testosterone levels were lower. Lastly, from all the patients who were the age-matched controls, they found that 100% of them were either in stage 4 or stage 5 of puberty. However, from the patients who had epilepsy, only 56.67% of them were in these last two stages. From these results, the scientists concluded that there was a delay in the sexual development and maturation of patients with epilepsy. What they also looked at was the difference between individuals with epilepsy, just in that subgroup, forgetting about the control, who utilize monotherapy or polytherapy, indicating that whether or not they're using one drug or many drugs to control their epilepsy. What they found is that individuals who only utilized one drug had a delay that was much less than individuals who utilized many. Put in other words, the more drugs you took to control epilepsy, the more delayed was your sexual development. Lastly, what they found was, as I mentioned before, 7 out of 10 patients are controlled through anti-epileptic drugs. Not all of them are. In this study, 61.5% of them were controlled. However, what they found was that no matter if they were controlled or were not, there was no statistical difference between how delayed their sexual development was. Lastly, the duration of how long they had epilepsy, whether it was for 2 years or 5 years, did not contribute to how delayed their sexual development was. So what were some limitations to this study? One was that, obviously, this was a small sample size. It was only 130 men, or boys. Additionally, it did not categorize the different types of epilepsy that they were testing. While it did go through it in the abstract, there was no specific categorization in the data scale that they used. Additionally, obviously, a lot of this is due to the anti-epileptic drugs, and it would be very interesting to see what the disparities are between just epilepsy causing these symptoms and the epileptic drugs causing them. So what does this have to do with evolutionary theory? If any of you have ever taken a human evolutionary biology class, you've learned about life history theory, and how we all have a finite amount of energy that we need to allocate to 3 very important things: maintenance, growth, and reproduction. What natural selection cares about most is reproduction. However, you cannot reproduce if you cannot maintain yourself and first grow to the age of reproduction. In patients with epilepsy, it can be hypothesized that they are still utilizing their energy towards maintaining themselves and growing, and do not have the excess energy to put towards reproduction. Thank you so much.